We all have had the term dengue fever. So today, we will know what dengue is and why it is so important to know about it. We'll also learn what makes dengue so dangerous. As we know, dengue is caused by mosquitoes. Dengue fever is a viral infection because it is caused by dengue virus. Not all mosquitoes spread dengue. Mosquitoes of genus Flavivirus spread dengue. They are Aedes aegypti mosquito, which have white and black stripes on it. Dengue fever is a RNA virus, not a DNA virus. When someone gets dengue fever, we can categorize it into one of the four categories. The four categories are dengue without warning signs, dengue with warning signs, severe dengue, also known as dengue hemorrhagic fever, and dengue shock syndrome. So, let's look at the first category, which is dengue without warning signs. Here, the mosquito will bite the person and inject the RNA virus inside that person. The virus will stay inside the person for about 4 to 10 days, and the person won't be feeling any symptoms whatsoever. The person will feel completely healthy. That 4 to 10 days where virus stays inside the person is known as incubation period. After 4 to 10 days, then the person will start to feel the symptoms of the dengue fever. Those symptoms last for about 7 days. The person will experience high-grade fever, which is 40 degrees Celsius or greater, and severe headache. Also, the person will be feeling pain behind the eyes, which is known as retroorbital pain. There will be pain in the muscle, pain in the joints, known as myalgia and arthalgia. Sometimes, a red rash appears on the skin, which is often itchy, and lymphadenopathy occurs. So, if you have a fever of 40 degrees Celsius or greater, and experiencing any of the 2 or more symptoms which have been mentioned here, there is a chance you might have dengue, so going to the hospital will be a wise decision. Usually, most of the individuals in this category get recovered from dengue fever. However, some do not. Those who are not recovered from dengue fever in the first category then fall into the second category. So, now let's look at the second category of dengue fever, which is dengue with warning signs. The second category is the critical period. It happens about 3 to 7 days after the person experiences the symptoms. Usually, the person will feel that he is fully recovered because he will not be feeling any symptoms. But dengue fever is still there. So, when the symptoms appear again, the person will experience abdominal pain, stomach ache. There will be a lot of vomiting. The liver can get big, about greater than 2 centimeters. This is known as hepatomegaly. Also, fluid in the blood vessels will come out, and if those fluid gets into the lungs, it can cause pleural effusion, and because of this, the individual will be coughing and not being able to breathe properly. If this fluid goes into the abdomen, it can cause ascites, which results in the stomach or abdomen to bulge out. The hematocrit levels increase because the fluid moves out of the blood vessels, not the red blood cells. The red blood cells in the blood vessels are still there, so the concentration of red blood cells increases. There will be bleeding from gums, nose, and round spots will be seen under the skin, which could be of color red, brown, or purple. This happens because there is bleeding happening under the skin. Now, let's move to the third category of dengue fever, which is severe dengue, also known as dengue hemorrhagic fever. This dengue hemorrhagic fever happens when a person is reinfected with a different serotype of dengue virus. What it means is that there are 4 serotypes, or simply 4 kinds of dengue virus. They are dengue virus 1, dengue virus 2, dengue virus 3, and dengue virus 4. So imagine if a mosquito having dengue 1 virus bites you, you get infected with dengue 1 virus. You go to the hospital and get completely recovered. Now you are free from dengue. So for your whole lifetime, you will be protected from the dengue 1 virus. But if a mosquito having dengue 2 virus comes and bites you, you will get dengue fever. This is because you were protected from dengue 1 virus. but not the dengue 2 virus. As a result, you will get dengue hemorrhagic fever. Dengue hemorrhagic fever happens after fever goes down. The patient thinks that he is well, but dengue fever is still there. The temperature of the patient will go down, resulting in hypothermia. There will be hemorrhages whereby the blood inside the blood vessels will come. The patient will see red spots on the skin because of bleeding happening inside the skin. There will be ecchymosis, which are like bruises having bluish purple color, which can be seen on the skin. This is because of hemorrhages inside the skin. There will be thrombocytopenia, which means the number of platelets will decrease. Platelets stop bleeding, but since they are now less in number, bleeding will happen. Liver will enlarge and liver failure can also happen. The patient won't know what's happening, will be confused because of change in mental status. Fluid will also leak out of the blood vessels. In severe dengue, the hematocrit level decreases because both fluid and blood are moving out of the blood vessels. With blood, red blood cells also move out, so the hematocrit will decrease. The fourth category of dengue fever is dengue shock syndrome. In this category, it is a combination of severe hemorrhagic dengue and shock. Because of shock, there is circulatory collapse in this fourth category of dengue fever. We have now discussed the 4 categories of dengue fever. Now we know why dengue fever is to be taken seriously. As we move from one category to the next, the severity of dengue increases. Nowadays, since there is frequent raining happening, there is high probability of mosquitoes breeding and laying their eggs. So if you have containers or flower vases with water in it, make sure to remove the water or replace it regularly. Empty tires often get filled with rainwater and mosquitoes breed there. So remove water from those tires. Mosquitoes breed in stagnant water, so keep the water flowing. Use mosquito repellents and mosquito nets to protect yourself from being bitten by a mosquito. If we take action, we can protect ourselves and our loved ones from dengue fever.